Good afternoon, everyone. My name is Tony Temporal. I'm with Tangible Solutions, and I am excited to be here today with Steve Burnett from Next Trust BillFlash. We are proud to be working with Next Trust BillFlash and partnering on this presentation. So without further ado, I'm going to turn it over to Steve.
Thank you, Tony. As Tony mentioned, my name's Steve Burnett. Here at Next Trust, I work with our resellers, and we appreciate the partnership we have with Tangible Solutions. Now, before we begin, we understand that questions will arise during the webinar for many of you. However, to ensure all questions are answered promptly, we ask that you please either write down or remember your question for later. And then during the last few minutes or so of the webinar, we've set time aside specifically for Q&A. So we'll get started. Today, we'll discuss the advantages of flexible payment options and how they can lead to an enhanced customer payer experience for your patients. We'll explore the financial benefits of offering patient financing for your practice, how to increase patient satisfaction and retention through patient financing, and then practical strategies to successfully implement and promote financing options. Later, we're going to talk about FlexPay, which is an easy to offer, easy to apply solution for patient financing. And not to jump ahead, but providers get paid in full up front. Patient financing provides access to the care your patients need and want, with flexible repayment options that allow them to pay their balance over time. Now, how does patient financing benefit and make a difference for your patients in practice? Currently, patient obligation is over 50% of the healthcare dollar. With the shift in financial obligation weighted heavily on the patient, it's increasingly essential for practices to adopt efficient billing and payment processes. Research shows that as patient financial responsibility rises, the likelihood of collecting patient payments in a timely manner significantly decreases. Interesting thought, 90%. Consider this. The average bill across healthcare is $600. Yet 40% of Americans can't afford a $400 unexpected bill. And then this leads to patients either not paying or delaying payment. And right now, providers are failing to collect 30 to 50% of patient balances. Even those with insurance often struggle to pay out of pocket for needed care. In the past, the patient would have had to make difficult choices, either back out of a procedure, rack up credit card debt, or take out a high interest loan with strict payment terms. But there is a way to change this dynamic, to lift the financial burden from patients while boosting your bottom line. By offering patient financing options, you can make essential and elective treatments accessible to more patients. Patients can get care regardless of their insurance status and break up expenses into manageable monthly payments instead of large upfront costs. For example, a patient who needs a $5,000 procedure but cannot afford to pay that amount up front may be able to budget $200 in monthly payments over 2 years. This allows the patient to move forward with the procedure they need or want. This approach not only helps your patients, it also enhances your practice's revenue, creating a win-win situation. Implementing patient payment plans can transform financial stress into financial relief, ensuring timely patient care and steady income for your practice. Also, an increased level of accessibility can have several benefits for your patients. More patients can get the care they need when cost is less of a barrier. This includes important services like preventive care, chronic disease management, and necessary treatments. Earlier intervention is possible when patients don't have to wait to save up for care. This leads to better health outcomes. More patients opt to complete elective procedures when financing is an available option. More options for where to seek care, as patients aren't limited to low-cost community clinics, and reduced stress from medical bills and improved financial well-being. Those are all great benefits for the patient, Now let's discuss how practices benefit from patient financing. Many practices still face significant hurdles, with 83% of physicians reporting slow patient payments as their greatest challenge. Dealing with patient collections, credit checks, and piles of administrative paperwork can be a massive headache. It takes up your staff's valuable time, which could be better spent on more meaningful work. But with modern financing solutions like payment plans, online payment portals, and billing applications with integrated collections, those mind-numbing manual tasks get automated. Streamlined processes can save your staff a significant amount of time and effort. Patients are becoming savvy shoppers when choosing medical providers, often doing extensive research and reading online reviews. In fact, 70% of patients read online reviews before scheduling an appointment with a new provider. Offering patient financing can give your practice an edge that attracts more patients. Practices that offer financing stand out by addressing patients' financial concerns up front. Understanding their financial limitations and willing to work with their financial situation creates trust and shows the practice cares about the full patient experience. Patients highly value this convenience and peace of mind. When a practice offers financing, it shows patients that their needs are not being placed on the back burner. Patients feel empowered to move forward with the needed care. And then, of course, this results in referrals and repeat visits. When cost is no longer standing in a patient's way, opportunities open up for new revenue streams for the practice. Patient financing programs can help do the following: attract more patients, leading to referrals and repeat visits. Increase case acceptance rates. Patients are more likely to move forward with treatments and procedures that have been recommended by their medical provider when they are presented with affordable payment plans. Can grow revenue. By improving case acceptance rates, practices can generate more revenue from procedures that may have been delayed or declined due to upfront costs. And improve collections. Instead of losing revenue from unpaid medical bills, financing allows practices to work with patients and collect payments over time through payment plans. This results in referrals and repeat visits. So now let's explore effective strategies for implementing patient financing in your practice. As we've seen, offering patient financing can make care more accessible and affordable, while also benefiting your practice through better collections, increased number of patients, and marketing differentiation. They need it, you need it. Following these guidelines will help you successfully implement financing in your medical practice. First, provide clear communication to patients about financing terms, costs, and consequences of non-payment. Having clear pricing and financing options available up front allows patients to budget and plan for a procedure. This also avoids stressful billing surprises down the line. Maintain transparent pricing and billing practices. Make sure financing eligibility and approval processes are fair and applied consistently. And protect patient data according to security best practices. Today's patients have more choices, and this positions financing as a strategic advantage. They are more engaged in their care and more likely to follow treatment plans. By expanding access and reducing financial burdens, financing options strengthen the patient-provider relationship from the beginning. This results in referrals and repeat visits. Integrating patient financing options requires some key steps to ensure successful adoption and maximize the revenue impact. Select a financing partner carefully by evaluating factors like interest rates, payment plan flexibility, application experience, reputation, and integration capabilities with your existing technology. Provide training to all staff members who will discuss financing options with patients. Have training sessions and provide employee resources. Something we do in sales, especially for a new employee, is provide scripts. Write out a suggested patient conversation and develop conversation guides for staff discussing financing availability. Make sure you also have consistent and compliant messaging. Update patient forms, documents, and pre-visit information to reflect the new financing option. and make patients aware up front. Market the new financing program across your website, social media channels, emails, as well as other patient communications. Use language highlighting the increased affordability. Monitor key metrics like financing application rates, approval rates, and revenue impact after launch. Improve processes as needed based on performance data. Benchmarking these metrics establishes a solid baseline, allowing progress to be measured moving forward. Offering patient financing is a win-win for healthcare providers and patients. It expands access to care by giving patients flexible options to pay out-of-pocket costs over time. For providers, it drives revenue through increased case acceptance, improves patient loyalty and competitiveness, and streamlines payments with steady upfront cash flow. In a time where patient responsibility amounts continue to grow, offering flexible financing solutions is becoming increasingly important for medical practices. The benefits of providing patient financing options are plentiful and cannot be ignored. Solutions like BillFlash FlexPay streamline the financing process for practices and patients. The average customer credit score across healthcare is 599, which starkly contrasts with the higher credit thresholds required by traditional financing methods for approval. But what do typical approval rates look like with traditional patient financing? Let's take a look. Traditional patient financing options are increasingly failing both patients and healthcare providers. Practices are often burdened with the uncomfortable task of selling financing options to their patients, diverting focus from their primary mission of providing care. How many of us or our front office staff have felt that way? Patients face the frustration of lengthy application processes, frequently involving copious amounts of paper forms, and endure anxiety as they wait, fingers crossed, to discover if they qualify for the financing they need. Shockingly, about 60% of patients are declined through these conventional financing methods, leaving them without the necessary funds to cover their medical expenses. This high decline rate not only hinders patient care, but also impacts the practice's revenue and patient satisfaction. Traditional patient financing options predominantly cater to consumers with above average credit, effectively sidelining a significant portion of the patient population. As a result, a lot of patients with lower credit scores are left without viable financing solutions, creating a substantial gap in access to necessary medical care. This discrepancy not only perpetuates financial strain on these underserved consumers, but also undermines the overall effectiveness of healthcare practices that are striving to provide inclusive care for all patients. So what are we doing about it? Great question. BillFlash's FlexPay aims to bridge this gap, offering more accessible and equitable financing options to a broader range of patients. In fact, with BillFlash FlexPay, 90% of patients are approved. There's a 30-second application. No more cumbersome paper applications. Our online application process is quick and easy. There are no hard credit checks. Patients can view their options without impacting their credit score. As mentioned, 90% approval rate. Balances as low as $60 can be financed. There are no late fees, and every approved patient will have a 0% interest financing option. Offering FlexPay can significantly benefit healthcare providers in multiple ways. Firstly, providers get paid in full right away, with payments initiated by the next business day, ensuring a steady cash flow. There's no operational lift as BillFlash manages every aspect of collecting patient payments, and providers face no recourse for patient non-payment. FlexPay also helps attract more patients since cost of care and travel time together comprise more than 70% of consumers' choice when selecting medical providers. Offering patient financing can differentiate providers and draw in new clients. Additionally, FlexPay aids in retaining existing patients. Why? By enabling them to say yes to recommended treatment plans and pursue care and elective procedures they might otherwise defer. By minimizing awkward conversations at the time of payment, FlexPay facilitates more positive interactions and speeds up the time to collect payments, enhancing overall patient satisfaction and operational efficiency. First of all, step one, patients will receive information about FlexPay financing options on their bills. Whether your patients received a mailed bill or an e-bill notice via email or text, we'll notify them that they now have the option to pay their balance in monthly installments with BillFlash FlexPay. Step two, the patient can select FlexPay at checkout, apply, and choose their payment plan right from their device. Patients can easily apply with just a few clicks, receive personalized options, and choose the payment plan that works best for them. And step three, you get paid right away, and BillFlash manages the rest. Your practice gets paid in full right away while BillFlash manages the payment plan and collecting payment from the patient. It sounds easy because it is easy. With quick approvals, low interest rate options, and provider payment right away, FlexPay empowers practices to boost their bottom line by providing more payment options for their patients. And that's a wrap. So thank you so much for joining us today. Our goal at NextTrust is to streamline your billing processes, reduce administrative burdens, and enhance your financial efficiency with our innovative BillFlash solutions. BillFlash FlexPay is created with a singular goal in mind to get you paid and ready to elevate your practice's revenue by offering FlexPay patient financing. We're here to help you out with that. And then you can schedule a demo today at billflash.com/tangible.
I just want to say thank you to Steve for presenting the webinar today. As he indicated, there's many benefits that we perceive that are good for our customers, and so we encourage our customers to at least check it out, investigate it, and see if it's a good fit for you. So thank you again, and thank you, Steve.
Thank you, Tony.
Have a good day.
Thank you all for joining us.